Hypertension or high blood pressure and chronic kidney disease are two health conditions that are closely related. We know the effect of the two on our bodies, but do you know the two have a bidirectional relationship as well, where one can lead to the other and both conditions can accelerate each other. This interplay can further create a vicious cycle where hypertension contributes to the development and progression of CKD, where CKD in turn can lead to or worsen hypertension. Time to understand the strong link between the two.
With hypertension, we know, as the definition says, it's the pressure of the flow of blood on the blood vessels which are carrying it. All of our blood goes through the kidneys for filtration of all the waste products.
Hypertension and chronic kidney disease are two related conditions that often coexist, and they can be asymptomatic or present with subtle symptoms, and knowing those are definitely essential for a better well-being.
Kidney disease is a silent killer. There are 5 stages of kidney disease, but until you are in the stage 4 and 5, you won't get any symptoms. So how do we tackle this? First thing I would like to say is everybody should, after 40, so definitely should go for regular health checkups. That is where we pick up small things like blood pressure or small rise in the creatinine can be picked up. In the later stages, when the symptoms arise, so what are the minor symptoms that you get and then the major symptoms? So minor symptoms would be like something like increased frequency of urination in the night, that we call as nocturia. In early stages also, there can be something called as frothy urine, like bubbles in the urine that we ignore. It is not causing us any problem, we ignore it. So frothy urine or change in the color of the urine, presence of hematuria, decrease in the amount of urine, progress to having something called as swelling in the legs, which we call as pedal edema, or swelling around the eyes, that is periorbital swelling, which they get up and they will notice, okay, around the eyes there is swelling, or the swelling in the leg which is not there in the morning, but as the day progresses they will notice there is a swelling. Hypertension also is very silent in the initial stages. You won't come to know that something is wrong with your BP. So sometimes you may get some headache, uneasiness feeling, sometimes you may get chest pains, blurred vision. So these are signs of high BP. And when very severe hypertension is there, at that point of time, you may also have some giddiness, some loss of consciousness or seizure-like activity as well.
Where people with hypertension are at a risk of developing a chronic kidney disease, but the percentage will vary.
There are various studies, and depending on the ethnicities, the percentage varies, and age group also. So if I say, like, I know of studies mentioning from 6% as high as 30% of hypertensives developing chronic kidney disease, and more so it is if it is essential hypertension, that is if it is developing after 50 years of age, the chances of having CKD is less. Like it's 6, the earlier age you get it, the chances of CKD worsens with time because the BP is uncontrolled for a longer duration.
While we might know the symptoms and possible solutions of the disease, but then there are some challenges and difficulties you might have to go through while controlling hypertension and CKD.
Sometimes BP is not controlled with one drug. So in that case, the compliance is a major issue. So that is there. Then the healthcare access. Like even if I tell them, these are the medicines and these are the tests they have to do. What is the access to it? You see, urban India is pretty much accessible, but the more we go towards rural side, that itself is a challenge.
So if you have hypertension or at a risk for CKD, it's important to work closely with your healthcare provider to develop a personalized treatment plan and address both conditions.